there, it's Todd Smith, the MPP for Bay of Quinte and the Minister of Children, Community and Social Services for the province of Ontario. And great to join you all for another COVID-19 update here on YourTV Quinte. Well, we are well into the first phase of the vaccine rollout for COVID-19. Well over 900,000 dosages administered across the province, and 270,000 people in Ontario have been fully immunized, meaning that they've received both the first and second doses of the vaccination. And most of those individuals are either residents of long-term care or their frontline staff in long-term care or other vulnerable places in the province when it comes to congregate care or in our hospital sector. And happy to say that many across the Quinte region have received their vaccinations, all residents of long-term care. And as a result, we've really seen the numbers of outbreaks almost disappear in long-term care, which is great news for our vulnerable folks who are living in that sector. And we are continuing with the rollout. Word is we're getting more vaccinations now. Of course, there was a long period of time where we weren't receiving vaccinations, and that's the responsibility of the federal government. Now the vaccinations will be coming. And of course, what we had to do at the provincial level was prioritize who was going to be receiving those vaccinations. So we'll be moving into phase 2 of the vaccination schedule very soon. Those between 60 years old and 79 years old will be part of phase 2. Those 80 and above were part of the first phase, and they're continuing to receive their vaccinations now at places like Loyalist College, which is our regional immunization center. Also down in Picton at the Prince Edward County Community Center. And Quinte Healthcare has been running vaccination centers themselves throughout the first few weeks that vaccinations have been available in the Quinte region. So in phase 2, those 60 to 79 are included in the priority stage, and those with special health conditions who fall outside of that 60 to 79 year age group as well have been prioritized by our team with the vaccination task force. So in my sector, in the community and social services sector, those who live in developmental services homes or those who are living with developmental or intellectual disabilities have been prioritized. Many of those individuals may be 50 years old, but the frailty level is more at the 80-year-old age level. So that's why those folks have been prioritized by the government, and their caregivers have also been prioritized in phase 2. Those who live and work in congregate care settings like group homes or shelters or violence against women shelters will be prioritized as well. And those who are in hot spots. And when we talk about hot spots, we don't mean places where it's warmer than other places. We're talking about where there have been higher rates of transmission, where there have been higher rates of hospitalization and higher rates of death. So those areas, those communities have been targeted as well in phase 2 of the rollout. And that's scheduled to be happening between April and July, phase 2. But of course, as more vaccines start to arrive in the country and in the province, we'll be able to speed up that whole process. There has been good news over the last week or so, and that is AstraZeneca, of course, has been approved as a vaccine here in Canada, and Johnson & Johnson has also been approved. Johnson & Johnson is a real game changer. The J&J vaccine is just a one-shot dosage, which makes it that much easier to get out and get people vaccinated. The problem is although it has been approved by Health Canada, we're not expecting any shipments of AstraZeneca or Johnson & Johnson vaccines in Canada until April. So we do have to get through the month of March by using Pfizer and the vaccines from Moderna that we have had approved already. And as those 2 new vaccines start to arrive in Canada, then we'll really start to see things ramp up. Here in the Quinte area, we have had the pilot project, which is underway, and allowing residents to pre-register for the registration date to go in and get vaccinated, part of that pilot project with Hastings and Prince Edward Public Health Unit. And if you haven't done so already, then you should probably go to the Hastings and Prince Edward Health Unit webpage. And that's HPE Public Health hpepublichealth.ca, and you'll see the icon or the tile on the home page for Hastings Prince Edward Public Health, which is simply titled Vaccines. And when you press on the vaccines tile, you'll be taken to all the information on vaccines, but there's an opportunity for you there to pre-register for getting the vaccine. All of this will then populate the provincial portal, I guess, if you want to call it that, or the provincial website, so that you'll get the call, you'll get the information when the vaccine is available for your specific age group or your specific priority group to receive the vaccination. So if you haven't done so, make sure you do that now. And again, Hastings and Prince Edward has been a pilot project for the province, and that big provincial-wide website will be up and running by next Monday. And so we're really looking forward to that. And of course, our area has been a leader throughout this pandemic at keeping caseloads low, but also in leading the way in ensuring that the rollout works as well as it possibly can. So the customer service desk is also going to be available next Monday. That'll be a phone line that you can call. The number isn't public yet, but as of next week, that number will be publicized. So if you don't have the ability to go online to get registered, then you will be able to call that number and get all of the information that you need to get booked for your shot when the shot becomes available. There was also some good news received last week from the National Advisory Council on Immunization. That's the NACI, National Advisory Council on Immunization. They've determined as well that instead of the 21 days between shots for those 2-dose vaccinations, it's now safe for that to occur over a 4-month period. So as long as you're getting the vaccinations within a 4-month time frame, they still will be you still will be able to fend off COVID-19 effectively. So that's really good news and allows us to ramp up even that much more and spread out the vaccinations to more people. So that was good news received by that organization. So this week actually does mark the first anniversary of COVID-19 arriving in Ontario. And I know many of you will remember the day that the schools shut down and the kids wouldn't be returning after March break in 2020, and how chaotic that was for everybody. But it has been 1 year. And as I've said many times, our folks at Hastings Prince Edward Public Health and Quinte EMS, our paramedics, and our municipalities in Bay of Quinte, especially in Quinte West, which is home to CFB Trenton, have been on the front lines for a lot longer than that. We were the first to welcome the folks back from Wuhan, China, those Canadians who were stranded in China and those who were stranded on a cruise ship off the coast of California. You know, we've been working harder and have been on the job longer than anyone else across the province in Bay of Quinte region. So kudos to everybody on making it 1 year, and we look forward to the light at the end of the tunnel here as we move out of COVID once and for all with the vaccinations on the horizon. Just a couple of other quick notes before we go for this week. Transit funding announced for our local municipalities from the province this past week to help make up for some of the lost revenue experienced with the lack of ridership that's been going on in Belleville and Quinte West and Prince Edward County in their transit systems. So well over $800,000 for the city of Belleville, which I know was welcomed by the mayor and council and the staff there. Operating funding was also received by our municipalities in Belleville, Quinte West, and Prince Edward County, and Hastings County as well. And I know that was welcome news too, as revenues continue to be down across our municipal governments. And also some mental health funding that was announced for Loyalist College. In particular, our post-secondary institutions are seeing an increase in the number of students requiring some support for mental health. And we also had some great news for those in the secondary and public school sector as well when it comes to mental health. And a big announcement or a bill announced last week, which will really pave the way to expanded broadband internet service, which I know is something that so many people across the Quinte region and elsewhere across the province have really come to depend on. There is legislation that's before the House right now that will pave the way to allow internet providers to use existing infrastructure that's owned by local distribution companies to put the capital equipment that they need on those poles, hydro poles, for example, to get the internet service to your community. So this is enabling legislation. After this passes, I think you're going to see a lot more good news when it comes to funding for expanding broadband internet across the Quinte region, which of course is so important for our kids who are doing a lot of their classwork online now, people at home working from home, and businesses that are using the internet that much more. So really good enabling legislation, and we hope to get that passed in the next couple of weeks and then pave the way for the expansion of broadband services across rural Ontario, including the Bay of Quinte. So that's it for this week. That's your COVID-19 update. Stay safe, and we'll talk to you in a week's time.